Okay, my name is Jacob. This is going to be my NG tube medication and removal video. So the first thing I do is I'm going to check my patient's chart. I'm going to note that I have to give a medication, and after that medication I'm going to remove the tube. So the first thing I want to do is I want to go to my med cart, do a little quick hand hygiene once we get there. And then I'm going to get my MAR, and I'm going to check out my MAR. I'm going to see what medication I need. So I know I need Tylenol in liquid form. I'm going to do the first of the 5 checks. In the 5 rights, the right patient, time, route, dose, and medication. So I know I need Tylenol liquid form. I'm going to pull that out of my stock supply. And I know that this is the right one. This is the first check, Tylenol, and they're only giving 1 medication. So then the second part is doing the second check. So I know that I have the right medication, the right patient, time, route, dose, and time. So that's good. And I know that I did my drug calculations, and I know the effectiveness of the drug, the adverse reaction of the drugs, the purpose of the drug, and any nursing considerations that I need to do this drug. So that all checks out. So now I'm going to open this up. I'm going to get down here on eye level. I'm going to pour 10 milliliters into my cup. Okay, that's good. I have my syringe here. I'm going to open this up. I'm going to aspirate all of the contents in this little cup. Then that equates to 10 milliliters. So that's good. I'm just going to double check that against my MAR. 10 milliliters is my second check. I think it's good. I got the right medication. All looks good. Kept this. So I'm going to set that aside. It's going to go in the garbage. And then my third check, as I'm putting it away, I did get the right medication for Jane Jones here. Time, route, dose, medication still. That all adds up. So I'm going to be putting this away. So that's put away. Lock up my med cart. And now I'm ready to go to my patient's room. First I need to gather a few more supplies. So I got my irrigation tray. I'm going to check all my supplies. Get them all. Make sure the integrity is good. The expiration date is not expired. Everything is valid. Everything is good. So now once I have all of that, I'm going to go to my patient's room. So I'm going to go to my patient's room, knock on the door, make sure I can gain entry. May I come in? Yes, okay. Hi there, my name is Jacob. I'm a nursing student from Madison College. How are you doing today? Good, your name and full date of birth is? Okay, Jane Jones, that's who I have here. I'm going to double check your wristband. Okay, you're good. And then is there any allergies that you have that I need to know about? Nope. Okay, that's good. So the first thing I need to do is I'd like to do an abdominal assessment on you, if that's okay. And then after that, I want to give you some pain medication. And then I'm going to actually remove that tube, if that's okay with you. Okay, the patient is compliant. I did my hand hygiene here as I came in, as I introduced myself. So that's good. So then, providing for privacy, pull the curtain around. We're going to do the abdominal assessment. I'm just going to click this here really quick. Okay. So the first thing I'm going to do is inspection. Okay, I would normally have her laying flat, but because of NG tube, I'm not going to be doing that. I would also kind of prop up her legs so then her abdominal muscles relax. So the first thing I'm going to do is I'm going to note this is going to be a normal stomach here. So I'm going to note the umbilicus is midline. I'm going to note for any kind of lesions, any kind of masses that I can see, any kind of distension. I would actually get down and kind of see the contour of the stomach. The color looks good. There's nothing wrong with the color. So then after that, I would go through with some auscultation. Just lube it up. I would clean my stethoscope. Get all that good. Good. Okay. Just a little wet still. Okay. And then, I should have this right here. Okay. Using the diaphragm, I'd start in the lower right quadrant. And I would listen for at least 15 seconds. Make sure I hear bowel sounds. If I did not hear any bowel sounds, then I would listen to a full minute, up to 5 minutes total. A minute each quadrant, that is too. Okay, there's bowel sounds. Hearing bowel sounds, okay. Alright, and I would also flip over to the bell, listen to the descending aorta, listen for any kind of bruit, kind of swishing sound. Nothing. I would also try to go to the femoral and the iliac if necessary. Alright, that's good. Okay, I'm going to cover you up here for a second here. clean off my stethoscope again. Okay. So I did that. I'm going to do light percussion next. Okay. So with percussion, I'm going to note for any kind of guarding, any kind of tenderness or anything like that. So just a light little listening for timpani. Okay. Okay, that's good. And then I would do a light palpation. So I just look for any kind of masses that I couldn't see or anything like that. And if she was ticklish, I would ask her to put her hand over mine as I was palpating for any kind of masses. Alright, there's nothing here, so that looks good. Everything checks out. So the next thing I need to do is on my nurse's notes. I need to check the length. So I brought out my little supplies here. So then I'm going to just put on some gloves. Alright, then I got the chucks from the door. This is just for you. I'm going to unpin that. There we go. And then just in preparation, I would also get the small, I might want to upgrade the emesis basin, but I would give her some tissues there, and then maybe she could hold on to this emesis basin. There we go. Just for you. Okay, so now I need to check the placement of it. So I got my little tape measure here. I'll go to the tip of the nair, measuring this going down. There you go. Get that away from your face. Going all the way down and noticing that it is about 10.5 inches, which matches up to my nurse's notes. So I know how long it is, so that's good. I can also get an O2 sensor, and I could check the O2 levels, and check the O2 levels on all this. And also noting that the very first placement is done by X-ray, and this has already been done. She's had this for a while, so that's why I'm removing it. And then after that, I need to aspirate a small amount of contents to check and see. Open up my thing. I don't want to get my marrow gooped up. I'm going to take this out. Okay, I'm going to set that there. I have my, I would use water for this, or you can use normal saline, which I have here. Expiration date is good, so I can just pretend it's water, pour some in there. Okay. I would like to aspirate a little bit of contents, but first I need to flush and make sure it's patent, so I'm going to do 30 mLs of air. And I'm going to flush that in there. I could listen to the stomach and make sure it sounded like a swooshing sound at this time, but I've already checked it. And then I'm going to aspirate a little bit of stomach contents. There we go, I got a little bit. Need to check the acidity, so I'm going to put it in this cup, squirt it in there. I'm also noticing that it is a light brown and green color, and I would also have one of these little test strips. Now these test strips, they only check for acid. I would have the ones that would actually tell me the exact pH level on it. I know that the I know that they're not taking any kind of antacids, so it should be a very low pH acidity. So that all checks out, and everything is good. The tube placement is now indeed in the stomach. So now I need to flush it. So I'm going to withdraw about 30 mLs. Where's that? There we go. A little bit more. Okay, 30 mLs. Hold on. We also have to check for the residual amount of the stomach contents, because we got to make sure that it's less than 400 milliliters before I do this. And I would also want to note how much I'm flushing with, so I can put that on my I's and O's chart as well. So I needed to check the residual after I did that. So then I'm going to do all of this. 60 ml syringe, and I'll say it comes up to 40. So there's only 40 milliliters of residual. So then therefore, according to facility policy, if this is going to go back in the NG tube or if I'm just going to dump it, we'll say this policy facility says to dump it in, so we put it back. That's fine. And now I need to flush it before I do the medication because I need to make sure it's patented and there's not any kind of stopping acid. So then this is where I do the 30 ml. Alright, so there's 30. Now I'm going to flush it with 30. There we go. So now it's flushed. So that's good. Now it's time for the medication. And then this is where I would do the third and final check. So I'd take my syringe here. You are indeed Jane Jones. Checking that against the MAR. I have the right time, date, route, patient, and the right medication. So I have all that. That's the third and final check, so that's good. I will then administer the medication. And then take this, not pulling on the nares because that's uncomfortable. Slowly administer the medication. Alright, there we go. That's good, it went down. Alright, now I need to flush this once again. So then since I'm flushing, it's not in between. In between I would be using 10 ml. So I'm going to flush with another 30. So my 30. Okay, we're going to do that. Flushing the rest of the medication down. Some water. Okay, so that's good. So I'm going to take my gloves off here, get some new stuff. Garbage, hand hygiene in between. Okay, now I'm going to explain about the removal of the tube. That this is going to be a little bit of an uncomfortable process, but they're going to feel a lot better. Once I do it, there might be some irritation to the back of the mouth throat area and also to the nares once this happens. So I'm just going to get on some new gloves. Okay. That's why I also provided with some tissue. You can see that. Tissue in the emesis basin, just in case they do decide to throw up. So I'm going to try to make this as painless as possible. So it is, it's unclamped. This tape is on there, so I'm going to carefully peel the tape off their nose, trying to be very sensitive to their skin. If there's any kind of like sticky residue, any of that kind of goop, I would use the special adhesive removal type stuff. And then I was going to tell them that I'm going to do this, so I would need to clamp. I'm going to try to wrap this around. I'm going to clamp the tube so then I can kind of fix it. I'm going to tell them to hold their breath so they don't aspirate. And I'm going to try to go quickly as possible so then I try not to tickle their gag reflex. So, okay, hold your breath. 1, 2, 3. I'm going to be coiling this around. Okay, you're doing good, doing good, doing good. We're almost there, and there we go. Okay, good. And then, good, they didn't throw up. That's wonderful. So then I would kind of dispose of this, wrap it up in my glove if possible. And then I would just discard this as a whole into the trash. We'll put that down there. And hygiene. Okay. Patient is good. I would offer some oral care, definitely, because they probably had this in their mouth for a while. So I'd offer them oral care. I would see if they need any other kind of services, if they need help to go to the bathroom or other. I would need to clean up my mess, take the chucks off. It's good. I would obviously need to document my MAR, what I did, document how much I flushed with, which was 60 mLs. Take this, and they need the Kleenex for later, so I'm going to save that for them. Their Colate is well within reach. I'm going to pin that back on them. See if there's any other thing I can do for my patient. Do the curtain again. There we go. The bed in the lowest possible position, clean up my stuff, and document how well the patient took the procedure, and make sure I did everything, and clean my stethoscope again because you can never clean your stethoscope too much, and that's my video.